So your child needs a CHAIT cecostomy tube. This is Betty Ann Thibodeau, pediatric urology nurse practitioner at the Stollery Children's Hospital. The cecostomy tube will be inserted under a general anesthetic. Your child may be in hospital for 3 to 5 days, depending on how they are doing. Before your child is discharged, you and your child will be taught how to care for the cecostomy tube at home. To learn more about what to expect on the day of your child's surgery, go to the Stollery website and search Your Child's Surgery. Immediately after surgery, your child will receive pain medication through their IV. Your child may have pain in their abdomen and around the cecostomy tube. Over time, the pain will become less, and your child will be switched to oral pain medications before going home. Once at home, the mild pain may continue for a while. Over-the-counter pain medications will help to relieve the pain. Speak to your pharmacist if you have any questions about your child's pain medications. The bowels normally contract and relax in waves to move food through the bowels. After the cecostomy tube insertion, the bowels may slow down or stop working for a period of time. It can take a few days for the bowels to wake up and start moving again. Some medications may also slow down the bowels. Your child may not have much appetite, may be unable to pass gas, may have some nausea and vomiting, and the belly may get distended or bloated. If your child has a lot of vomiting, your child may need a tube inserted through the nose into the stomach to drain the stomach until the bowels start working again. Usually when the bowels begin to work again, your child will have a lot of crampy pain. Getting up and walking will help the bowels move and relieve the discomfort. A CHAIT cecostomy tube is thin, soft, flexible plastic tube with a coil on the end. The tube is inserted into the cecum or the beginning of the large bowel through a small hole in the belly. The coils anchor the tube in the bowel. The trap door of the tube allows you to flush a large volume of fluid into the bowel to clean out the large bowel. The cecostomy tube is a different way of giving an enema and helps reduce or prevent bowel accidents. The cecostomy tube is usually inserted in radiology under a general anesthetic. The procedure is done in 2 stages. Your child will have a temporary cecostomy tube inserted initially, and then 6 weeks later have the permanent tube inserted. Both procedures will be done in the radiology department. If your child has a cecostomy tube inserted in the operating room while they're having other surgeries, the permanent cecostomy tube is usually inserted rather than inserting a temporary tube first. After the initial procedure, your child will have a temporary cecostomy tube, which will stay in place for approximately 6 weeks. Your child will have a large dressing on the belly covering the temporary cecostomy tube. During the procedure, anchor strings are used to hold the bowel up to the belly wall. These strings will be wrapped tightly around a plastic piece and taped to the belly wall with special tapes called Stollery strips. The tube will be held in place by a special securement device or medical grade tape. To prevent infections, it is important to always wash your hands with soap and water, before and after any tube care, as well as before and after you change the bandage. Gently wash the skin around the cecostomy tube with warm soapy water. Pat the skin dry. Apply antibiotic ointment around the tube site with a cotton swab every day until the permanent tube is inserted. Do not use any powders or lotions on the skin around the tube site. Your child may have a shower with the bandage on. Change the bandage once per week until the permanent tube is inserted, or sooner if the bandage is wet or loose. Keep the cecostomy area covered with a bandage to prevent the tube from getting accidentally pulled out. Be careful when removing the old bandage so you do not pull in the cecostomy tube or the plastic piece holding the anchor strings. Always keep the temporary cecostomy tube held in place with a securement device or medical grade tape so it does not get accidentally pulled out. For the first week at home, flush the temporary cecostomy tube with 10 ml of normal saline twice a day to prevent the tube from getting plugged. If the temporary tube falls out, go to your nearest emergency department. Take the Foley catheter with you. Do not try to replace the temporary tube with a Foley catheter as the tract is not healed yet. To flush the temporary cecostomy tube, you will need a 10 ml syringe filled with normal saline. Use a new syringe with each flush. First, clean the cap on the end of the cecostomy tube with an antiseptic swab. Remove the white cap from the syringe. Attach the syringe to the clear cap by pushing and then twisting the syringe onto the clear cap. Slowly flush the 10 ml of saline into the temporary cecostomy tube. The water should flush in easily. Once you're finished, unscrew the syringe from the clear cap and discard the syringe. The anchor strings which hold the bowel up to the abdominal wall will stay in place for 2 weeks. It is important that the anchor strings remain tightly wrapped around the plastic piece and the plastic piece stays securely taped to the belly. Replace any of the tapes or steri strips right away if they loosen or fall off. Your child should continue a high fiber diet and drink plenty of fluids. You can continue your child's normal bowel routine, such as rectal enemas or suppositories to control your child's constipation or bowel accidents until you begin the large volume flushes. 1 week after your child is discharged from hospital, you will begin the large volume flushes. You will begin the flushes with 50 ml of tap water once per day and increase the volume by 50 ml every 3 days. You will begin the flushes with a 60 ml syringe, but switch to a feeding bag when you're flushing a larger volume of fluid through the bowel. Gather your supplies. You will need a 60 ml syringe or a kangaroo feeding bag, a connector tube, and warm but not hot tap water. If you're using well water, boil the water first and allow the water to cool before using. You can also use bottled or distilled water. Remember to clean the connector tube and the temporary cecostomy tube with antiseptic swab before attaching these tubes together. Your child should be sitting on the toilet before you begin the large volume flushes. You'll likely not have much results until you're flushing with a larger volume. When using the 60 ml syringe to do the flushes, fill the syringe with warm tap water. Remove the clear cap on the temporary cecostomy tube. It's easier to flush the larger volumes of water through the connector tube if you remove the clear cap. Clean the connector tube and the temporary cecostomy tube with an antiseptic wipe. Attach or screw on the connector tube to the temporary cecostomy tube. Attach the syringe to the temporary connector tube and flush the water through the tube into the bowel. Once you're finished the flush, remove the syringe and connector tube from the temporary cecostomy tube. Always replace the clear cap on the temporary cecostomy tube after you're finished. Wash the equipment with warm water and soap. Rinse well and allow to dry on a clean towel or paper towel. Your child should be sitting on the toilet before you begin the large volume flushes. When using the feeding bag to do the flushes, ensure the roller clamp is closed or the water will run out onto the floor. To fill the bag, open the lid on the top of the feeding bag and fill the bag with the appropriate amount of warm, not hot, tap water through the top of the bag. Squeeze the drip chamber so that you get some fluid into the chamber. If you do not fill the drip chamber, you will get a lot of air into the tubing while you're doing the flush. Open the roller clamp part way to slowly fill the tubing with water. Close the roller clamp once the water reaches the end of the tubing. Remove the clear cap on the temporary cecostomy tube. It's easier to flush the larger volumes of water through the connector tube if you remove the clear cap. Clean the connector tube and the temporary cecostomy tube with an antiseptic wipe. Attach the connector tube to the temporary cecostomy tube. Attach the feeding bag to the temporary connector tube and flush the water through the tube into the bowel. Open the roller clamp to flush the water into the bowel. Once you're finished the flush, remove the feeding bag and connector tube from the temporary cecostomy tube. Put the clear cap back on the temporary cecostomy tube. Wash your equipment with warm water and soap. Rinse well and allow to dry on a clean towel or paper towel. Hang the kangaroo feeding bag high above your child on a hook behind the toilet or an S-hook over the shower curtain rod as the water flows down by gravity. Slowly open the roller clamp halfway to allow the water to flow into your child's belly. As your child becomes more comfortable with the flushes, you may be able to open the roller clamp more to speed up the flow of the water. Some individuals can tolerate the roller clamp being wide open. If your child becomes crampy with the flushes, slow down the flow rate by adjusting the roller clamp or decrease the volume of water that you're flushing. The whole process should take 45 to 60 minutes. Your child should remain on the toilet until everything is flushed through and there's no more stool or water flowing into the toilet. If there's no water flowing when you're trying to do the flushes, try hanging the bag higher. When finished, wash your equipment with dish soap and water and allow the feeding bag to air dry. You can continue to use the same feeding bag until the bag starts to leak or no longer works. This is the flushing schedule that you will follow. As you can see, you will increase the volume by 50 ml every 3 days. The volume of tap water required to flush the bowels is different for everyone. Use the flushing schedule to slowly increase the volume of tap water and find the right amount of water for your child. Your child may need more or less volume than what is recorded on the schedule. You will know you have the correct volume when the flushes are completed within 45 to 60 minutes and your child does not have any accidents or staining in the underwear for 24 hours. If your child complains of cramping with the flushes, adjust the flow rate by slowing down the flush or decrease the volume you are flushing. It may take some time to find the correct volume or flow rate that works for your child. Once you know the volume that works for your child, the flushes should be done every day. 2 weeks after the temporary cecostomy tube was inserted, the anchor strings will need to be cut. You may cut the strings yourself or schedule an appointment with your child's family doctor. To cut the anchor strings, gently remove the bandage over the temporary cecostomy tube. Clean the area around the tube with soap and water. Cut the strings close to the skin. You can unroll the strings from the plastic piece to make it easier. Do not cut or nick the temporary cecostomy tube. The strings left inside the bowel will pass through the bowel with the stool. Apply antibiotic ointment around the tube and cover with a dressing. Continue to keep the temporary tube secured with a special securement device or medical grade tape to prevent the temporary cecostomy tube from being accidentally pulled out. As your child will have to sit on the toilet for at least 45 to 60 minutes, some tips to keep your child comfortable during their flushes include using a step stool or squatty potty under the feet so the feet aren't dangling. This may help your child empty their bowels as well. A towel or blanket on the lap for warmth, a small pillow behind the back for comfort, setting up a small table in the bathroom for your child so they can do their homework, or setting up an iPad for them to watch TV shows, movies, or play games. Sometimes your child may have some mild discomfort from the tube site. Use over-the-counter pain medication as directed. If you have questions about the pain medication, call your pharmacist. If the pain medication is not working and the pain is getting worse, call your doctor. Your child may have some minor skin irritation or redness around the tube. This is normal. If the redness around the tube is getting worse, hot to touch, and spreading out from the tube, call your doctor. Sometimes your child may develop some red, beefy-looking tissue that bulges out around the tube. This is called granulation tissue. This tissue is normal and can be treated in the clinic if it becomes bothersome. These are pictures of normal redness around the tubes and granulation tissue. Call your doctor or Betty Ann if there are signs of infection around the tube, the granulation tissue is becoming a problem, the cecostomy tube has fallen out, or you're having difficulty managing your child's care at home. Signs of infection may include fever, red, swollen, and sore area around the tube, the redness around the tube is spreading outwards, pus from the tube site, or a general feeling of unwellness. If you have concerns about your child, you can contact your doctor, or you can call Betty Ann at 780-407-7010 Monday to Friday during the day. You will need some supplies to care for your child at home after surgery. You can either purchase the supplies from a healthcare store, your pharmacy, or online. You may need to go to more than one store to purchase the supplies. For your convenience, you may purchase a care at home kit from the hospital. This kit will contain the supplies you require to care for your child for the first few weeks at home. This package must be purchased before your child is discharged from hospital. Please let your nurse know if you require a care at home kit. This is a list of supplies your child will need at home after surgery. The radiology department will call to schedule a follow-up appointment to have the permanent cecostomy tube inserted. The permanent cecostomy tube is usually inserted around 6 weeks after the temporary tube was inserted. If you have not heard from the radiology department, you can call 780-407-8850 during business hours. Your child should be seen by your doctor approximately 2 to 3 months after the cecostomy tube was inserted. If you do not have an appointment, you can call 780-407-1980 to book a follow-up appointment with your doctor. Now we will discuss how to care for the permanent cecostomy tube after the temporary cecostomy tube is removed. Approximately 6 weeks after the initial procedure, the temporary tube will be replaced with the permanent cecostomy tube or a CHAIT trapdoor cecostomy catheter. The tube will be replaced in the radiology department under a general anesthetic, but your child will be able to go home the same day. The permanent tube will need to be replaced once per year or sooner if the tube falls out or breaks. As your child grows and matures, your child may not need a sedation for the annual tube changes. The CHAIT cecostomy tube lies flat against the skin on the abdomen. The tube is inserted in the cecum or the beginning of the large bowel and held in place by the coil positioned on the inside of the bowel. The coil helps to prevent the tube from getting accidentally pulled out. The trapdoor on the cecostomy tube opens to allow easy access to the bowel to do the flushes and clean out the large bowel. Once your child has been switched to the permanent cecostomy tube, you will need a special connector tube called a CHAIT access adapter to flush the cecostomy tube. You should be given this connector tube when the permanent cecostomy tube is inserted. You will follow the same process as before with the kangaroo feeding bag, except you use a new access adapter to connect to the cecostomy tube rather than the previous connecting tube. You will need the access adapter and the kangaroo feeding bag with the appropriate amount of warm tap water in the bag to do the large volume flushes. Before you connect the access adapter to the cecostomy tube, close the pinch clamp on the access adapter. After you connect the access adapter to the cecostomy tube, you will open the pinch clamp to allow the water to flow through into the cecostomy tube. To flush the cecostomy tube, open the trapdoor of the cecostomy tube. Insert the metal pin into the opening of the cecostomy tube. Line up the plastic pin in the trapdoor with the small hole on the connector tube. Once properly aligned, push the pin into the hole of the connector tube. This helps to secure or anchor the connector tube to the cecostomy tube during the flushes. You can then connect the kangaroo feeding bag to the access adapter to do the flushes. Once the flush is completed, remove the connector tube and the kangaroo feeding bag, and then close the trap door of the cecostomy tube. If the cecostomy tube falls out, gently insert an 8 French Foley catheter into the hole where the cecostomy tube was. Do not inflate the balloon. Secure the catheter to the abdomen with medical grade tape. To prevent fluid from leaking out the catheter, insert a catheter plug into the end of the catheter. Call Betty Ann or your doctor to have the cecostomy tube replaced. This video was made to help you care for your child at home and made possible with funding from the Stollery Children's Hospital Foundation.